Hi, Miss Daniels. How are you feeling today?
I keep coughing.
How long have you had that cough?
About 3 or 4 weeks now.
And how have you been eating?
Well, I haven't really been eating that much. Don't eat as well as I used to. I'm so tired all the time, and every time I cough, sometimes I spit up stuff, and it's got a little blood in it, so I'm kind of worried about that.
Well, when we took your vitals earlier, we noticed you had a fever.
Yeah, about this time every day I've been having a little fever, and I get real warm, and then I just get real cold, and I'm sweating all night.
Okay, well, I'm going to go ahead and order a TB test to be done for you.
Oh, okay.
And I'm going to go ahead and go get that, okay?
Okay, I'll be here.
A client will usually have a positive TB test within 2 to 10 weeks of exposure to the infection.
A TB skin test should be read in 48 to 72 hours. An intradermal injection of an extract of the tubercle bacillus is made. An induration, palpable, raised, and hardened area of 10 millimeters or greater in diameter indicates a positive skin test. An induration of 5 millimeters is considered a positive test for immunocompromised clients. A positive Mantoux test indicates that the client has developed an immune response to TB. It does not confirm that active disease is present. Clients who have been treated for TB can retain a positive reaction. Individuals who have latent TB can have a positive Mantoux test and can receive treatment to prevent development of an active form of the disease. Clients who are immunocompromised should be tested for TB, and clients starting immunosuppressive therapy should also be tested for TB prior to starting the treatment. Patient education should include reinforcing the importance of returning for a reading of the injection site by a healthcare professional within 48 to 72 hours, and if the test comes back positive, the patient should be referred to have a chest x-ray.
Hello, Miss Daniels. Your TB test and chest x-ray both came back positive.
Oh my gosh.
No, so we're going to go ahead and do a sputum culture, and I'm going to need you to spit in this cup.
Okay.
The healthcare professional will make sure to obtain 3 early morning sputum samples.
And I'm going to go take this to the lab, and I'll be back, okay?
All right.
Hi, Miss Daniels. Your doctor has prescribed you isoniazid and rifampin. You're going to take these both by mouth.
Okay.
This is your isoniazid. You're going to take it for 6 to 18 months.
Isoniazid is commonly referred to as INH and is bactericidal and inhibits growth of myobacteria by preventing synthesis of mycolic acid in the cell wall.
Okay, and this is your rifampin. You're going to take this for 4 to 5 months.
Rifampin is commonly referred to as RIF and is a bacteriostatic and bactericidal antibiotic that inhibits DNA-dependent RNA polymerase activity in susceptible cells.
Rifampin. Routes of administration. Rifampin is available as capsules and in 2 fixed-dose combinations of capsules or tablets with isoniazid or INH. Give rifampin with other TB drugs to prevent resistance. Give oral dose 1 hour before or 2 hours after meals. Rifampin is also available in IV form. Give IV infusion in recommended diluted rate. Black box. Warning, 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 warning.
Drinking alcohol along with rifampin can lead to fatal liver toxicity. You need to encourage the patient to stop drinking as soon as possible.
Side effects.
While taking rifampin, the patient can also experience symptoms such as nausea, vomiting, diarrhea, cramping, and abdominal pain.
While taking rifampin, the patient must be aware that their body fluids may have a red-orange color, and also if wearing soft contact lenses, discuss the possibility of permanent staining with optometrist. Our previous patient, Ms. Daniels, is now having her monthly checkup by her home health nurse, Kristen.
Hello, Miss Daniels. Hi. Oh my gosh, you look so yellow.
I do? Oh my goodness.
I think you're experiencing symptoms of jaundice, which is due to liver toxicity.
Oh my gosh.
So I'm going to go ahead and call your doctor.
Oh, please do.
Throughout the treatment, the nurse should have been monitoring the liver enzyme levels of the patient.
Isoniazid. Routes of administration. Isoniazid is available as tablet and oral syrup. Give tablets in combination with rifampin. Give oral drug on an empty stomach 1 hour before a meal, if possible. Give IM dose in large muscle mass and rotate sites. If IM form contains crystals, warm it to room temperature before using. Give isoniazid with one or more other drugs for active TB to prevent resistance. Give isoniazid by itself daily for latent TB for 6 to 9 months treatment. Black box. Warning.
Severe and sometimes fatal hepatitis may occur. It usually occurs within the first 3 months of treatment, although it may develop even after many months of treatment.
Side effects.
Our previous patient, Ms. Daniels, is now having her monthly checkup 2 months into her treatment by her home health nurse, Kristen.
Hello, Miss Daniels. How are you doing today?
Well, I'm doing okay, but I'm having this tingling pain in my hands and my feet, and I can't really be grabbing stuff like I used to and holding things. It kind of just slipped through my hands, and then it's getting really hard for me to walk around and stuff by myself. I have to use my cane in my walker more often than I usually do. I don't really understand what's going on.
I think you may be experiencing a side effect called neuropathy, and it's a side effect of isoniazid. So we can go ahead and get it ordered for vitamin B6, and that's going to help with that.
Okay, I like that. Let's do that. Let's
okay,
go with
let me
that.
call your doctor and get that ordered.
Oh, okay.
Another side effect of isoniazid is constipation. The patient would need to increase fiber and fluids in the diet to prevent this side effect. Our previous patient, Ms. Daniels, is now having her monthly checkup by her home health nurse, Kristen.
Hello, Miss Daniels. How are you doing today?
Well, I'm doing okay, but it's just that the price of my medication I don't know if I can keep affording it. It's either eat or, get your medication. And I know y'all have told me that I can't just stop it and I have to finish it, or it's going to be, what is that called? Resistant or something but anyways, I don't know if I can keep my lights on or anything anymore, or pay for my medication, and it's just becoming a real struggle, and I'm getting real stressed about it. Is there anybody that can help me, or is there anything they can do for me?
Yes, Miss Daniels, we can get you some help with that.
The nurse can usually offer the patient social services number if the client will need assistance in obtaining the prescribed medication. The usual price for isoniazid 10 mils injection is $352.06. For the syrup, it is $217.60. And for the tablet, for 10 milligrams, is $14.75, and 300 milligrams tablet is $40.10. For rifampin, the capsule price is 150 milligrams, $117.17. 300 milligrams, $331.90. And for the solution reconstituted, it's 600 milligrams, $214.27. And another reconstituted solution is $135 even. After the nurse has contacted social services, the patient now has easier access to her medications.
Hello, Miss Daniels.
Hi, I just want to thank you so much for getting me that help and getting, that medication for me. I'm really so thankful for you just being there for me and being a great nurse and doing everything you can to make sure that I'm okay.
Well, that's what we're here for, and I want to remind you again, make sure you take that full treatment of those drugs that I gave you.
Okay, I will.
Okay.
And some additional patient teaching that the nurse can provide to her patient would be to provide the client and family education because TB is often treated in the home setting. Airborne precautions are not needed in the home setting because family members have already been exposed. Exposed family members should be tested for TB. Educate the client and the family to continue medication therapy for its full duration of 6 to 12 months, even up to 2 years for multi-drug resistant TB. Emphasize that failure to take the medications can lead to a resistant strain of TB. Instruct the client to continue with follow-up care for 1 full year. Inform the client that sputum samples are needed every 2 to 4 weeks to monitor therapy effectiveness, and clients are no longer considered infectious after 3 consecutive negative sputum cultures and may return to former employment. Encourage proper hand hygiene. Instruct the client to cover mouth and nose when coughing or sneezing.